Do alarms work? I mean, how many times do you hit the snooze button in the morning? Smoke alarms. I mean, if it goes off every time you throw a New York strip in the pan, you might find it bothersome. Kind of like how you react to a car alarm. How often do you just cover your ears and complain how annoying it is? The latest headline when it comes to the coronavirus in the Treasure Valley is about how Boise's mayor and medical leaders from 3 major Idaho hospitals are sounding the alarm as COVID infections soar again. Are we treating these alarms like the morning snooze button? This afternoon, Boise's Mayor McLean got together with St. Alphonsus, St. Luke's, and Primary Health to offer yet another plea for Idahoans to get vaccinated. Idaho's case count is rising, hospitals filling up, and the most common victims are the unvaccinated. The Idaho Department of Health and Welfare reported nearly 700 new cases of COVID yesterday. Number of new daily cases indicated by those blue bars there. The 2-week moving average is that dotted line that you also see. Yesterday's 680 new cases are the most since January 20th, which was just weeks after the vaccine rollout began. But we're told those case numbers are not the most important stat to which we should be paying attention. It's those hospitalizations due to COVID, and those are rising as well. St. Luke said this afternoon the number of patients admitted to the hospitals over the last 2 weeks have nearly doubled from 40 to 79. St. Al's saying they are also seeing an increase. And there is a trend. They're all younger, sicker, and unvaccinated. And it's why Mayor McLean put together this virtual public health press gathering. Shira Matsuzawa listened into the Zoom call today. And Shira, those COVID numbers we just told you, they're not the only ones going up.
Yeah, Brian, you know, Primary Health CEO Dr. David Peterman says the number of people going in to get tested for COVID is also going up. He says it has tripled for Primary Health, and most are symptomatic and most are coming from the more contagious Delta variant. And that's according to Dr. Peterman. He adds every age range has at least a double or triple increase. And what's most concerning is in the 5 to 12-year-olds, because there is a triple increase in that positivity rate.
We're kind of entering the class 5 rapids of this pandemic. Just like when you try to navigate a class 5 rapids, we all got to work together. Every single rower's got to put their oar in the water at the same time, and the right and the left sides of the boat got to work in tandem.
What we all need to understand is, unfortunately, Delta is a very different virus than what we dealt with in December. The vaccine is not 100%, but no vaccine is 100%. And you're 5 to 8 times more likely to get infected if you're not vaccinated. But here's what we absolutely do know. If you're vaccinated, your chances of being admitted to the hospital are very, very small, maybe less than 3%. And your chances of dying even more remote.
Now, I spoke with Dr. Peterman after that media briefing today, and he tells me on Tuesday they had more than 1,300 people visit urgent care, which is the second most visits to urgent care in the history of Primary Health. And on Monday, that was the 3rd busiest day. The primary reason for those visits were respiratory related. So again, the message here that they're trying to get to everyone is get vaccinated and wear a mask indoors, regardless of vaccine status. Brian?
Yeah, and we've heard from several people who have been hesitant to get the COVID vaccine. It's only because it's emergency authorized at this point, not fully approved by the FDA. So when could that happen? Well, possibly as early as next month for the Pfizer vaccine, according to the New York Times. That's as much earlier than expected, as many, including President Biden, weren't thinking that it would happen until at least early fall, probably beyond that. And maybe health officials are hoping that would be enough to persuade the rest of the eligible Idahoans to, instead of hitting that snooze button once again, to actually get out of bed and get the shot. Right now, nearly 694,000 Idahoans are considered fully vaccinated by Health and Welfare. And that's about 46% of those eligible and about 38% of our total population.